we have the Chanjo system, and I'm aware people are receiving their SMSs to be able to come forward. And what is good is that this system enables us to audit who exactly got their first and second dose. And I must say, recently I was remarking at the utility of the system, because we have people who are coming to us asking for booster shots, third doses. And when I get to the system, I can actually tell that you got your first dose of Astra, got your second dose of Astra, and so there's no way the system will even allow me to actually input you to get you your third dose. And remember, that system is tied to the logistics and the supply chain, and the accountability for the doses. And so really, it's a system that is really helping in this, that we are utilizing to remind Kenyans to come forward, but also, of course, helping to make the whole process accountable. And because I've mentioned the third dose, let me just clarify on that and really highlight that right now, the government position, the ministerial position, is that we are not issuing any third doses. We have seen different countries who are in advanced discussions to move towards the third dose. And for us, our priority is to ensure, first, that we get more Kenyans captured, that we have at least our elderly, our healthcare workers, our essential workers, people with chronic conditions captured, and then, of course, the other population before we can even consider the issue of the third dose. And, of course, this is purely a supply chain issue, purely an issue that deals with ensuring we have vaccine equity even within our own country. I think the last question you've talked about is tracking, and I think I've shared with you that the Chanjo system is actually able to track. We're actually able to do an audit and pick out defaulters. Remember, when you come in, you do share your location, your ID, so we are able to track you. But right now, the primary tool we're using is social mobilization, to just remind Kenyans you need to come back for your second dose. Are there any ill effects? Would you get unwell if you didn't get your second dose? Would you, get unwell in terms of your risk or your propensity for risk for COVID? Of course, there is a risk there. You need to be fully vaccinated. However, you walking around without a second dose doesn't necessarily harm you beyond the sphere of COVID-19 as a disease.